Doctors are speaking out against the Medical Association's stance on the cannabis referendum. One doctor has gone as far as cancelling her membership of the professional group. The Medical Association opposes legalising cannabis because of the harm it can cause individuals and the community. But several doctors are now going public, saying that is not the universal view of medical professionals. Ben Strang reports.
The Medical Association strongly believes that cannabis use is a significant health and social problem, causing psychological harm to its users, particularly young people. The No campaign, led by the likes of Family First, has been quick to seize on this. They're pitting the debate as one between the Greens and the Drug Foundation against medical professionals. But a number of doctors have come forward to RNZ to say that simply isn't the case. Dr. Nina Sovisky has even gone so far as to quit the Medical Association.
I decided to leave because I felt that their stance on the cannabis referendum, while it wasn't incorrect, I felt it was incomplete. I didn't feel that it addressed the wider spectrum of harm that comes from the current use of cannabis. I felt they took a fairly narrow medical focus.
She says the association isn't representative and that many doctors like her have opposing views. Another doctor supporting legalisation and denouncing those of the Medical Association is Richard Medlicott, the medical director at the Royal New Zealand College of General Practitioners.
I think if you look at the evidence around use in New Zealand, which can be harmful, this legislation is well written, puts in protections, and I expect will reduce harm.
Opponents to legalisation say some of those provisions can be put in place without legalising weed, such as better access to health services. The NZMA says civil penalties should be in place for cannabis possession, leading to counselling, education and treatment, rather than being pushed through the criminal justice system. It would be a form of decriminalisation rather than legalisation. Dr. Medlicott doesn't agree with that.
It's kind of a change in the rules that doesn't really go far enough. You'd still have people who want to purchase marijuana going to sometimes some pretty dodgy places and mixing with some pretty dodgy characters. You'll still have high-potency marijuana available. You'll still have it being pushed on the under-20s. So, yeah, I don't think decriminalisation is the way. Legalisation has to be the better option.
Dr. Stephen Graham, the medical director at Wellsouth in Dunedin, also supports legalisation and says it will take away the anxiety some people feel when needing help because of cannabis. He says doctors need to be more honest.
I don't think we know if people are being open with us about it. We really can't say. You know, there is still the legal concern in there, and it does get in the way of open discussion.
That was echoed by Dr. Sovisky.
It's hard enough getting an accurate alcohol history from patients, and alcohol's legal, but people often minimise their alcohol use until there's a climate of trust and support. It's hard enough anyway with a legal substance, but with an illegal substance, I think patients are often anxious and frightened to tell their doctor about how much they're using.
The Medical Association wasn't available for an interview, but admits its stance isn't the view of all doctors or all of its members. It says it has always made that clear. But news releases and other information from the association doesn't make that clear, and doctors RNZ talked to say not everyone was canvassed before it announced its stance. The association says it has a robust process on policy and advocacy with members, which informs the position it takes. For Morning Report, Ben Strang.